Stroke affects around 3% of global population at some point of their life, and it's second most common leading cause of death in the world. Stroke has huge importance. You can see stroke here. This is dead tissue actually caused by stroke, and we have two main types of strokes. First is when we have blockage of artery in the brain. It can be caused by clot or thrombosis, and it is called ischemic stroke. Ischemic stroke is the most common type of stroke. It develops 87% of cases. Second type of stroke is hemorrhagic stroke, which is represented around 13% of cases, and it is caused by ruptured artery and bleeding inside brain. You can see here ruptured artery and bleeding, hemorrhage. This part is hemorrhage. You can see on CT scan also hemorrhage. It's brighter than general brain tissue. And here you can see ischemic. Here we have blockage, and after blockage we already have dead tissue in the brain. That's ischemic stroke. So we have these two main type of strokes, and we have third type, and this third type also called as mini stroke, and its name is transient ischemic attack. It's almost similar to ischemic stroke, but different is that symptoms will go away less than 24 hours. So it's highly reversible process, and it's much milder. But it's very important because after transient ischemic attack there is almost 30% risk of major ischemic stroke. So it is also called as warning stroke or mini stroke, and we should pay attention to this. And now let's say what is most important symptoms of stroke. We should remember three main symptoms: face dropping, arm weakness, and speech difficulties. And time to call 911. It is called FAST acronym, and we should pay attention to these three main symptoms: face dropping, arm weakness, and speech difficulties. And if we detailize these symptoms, weakness and numbness is the most common symptom. Weakness and numbness of face, usually one side of face, one side of arms or hands or legs. So face, hands and arms and legs. Weakness and numbness, that's most common symptom. Another most common symptom is difficulty seeing, difficulty speech, difficulty understanding. They are also common. As we already said, they are caused by thrombosis or emboli, and blood clot obstructs artery, and due to ischemia, brain tissue dying. And risk factors for ischemic stroke is high blood pressure, hypertension, smoking, diabetes, high cholesterol, and heart disease, because emboli can come from anywhere, almost anywhere. For example, from heart. For example, because of arrhythmias, blood clot can develop in heart and travel through arteries, and it can wedge into brain and cause stroke. And now let's say about hemorrhagic stroke. About hemorrhagic, we say that it is caused by rupture of artery, you can see here, and bleeding. And what is symptoms? When we say that face dropping, arm weakness, speech difficulties, most commonly is ischemic stroke. But if we're talking about hemorrhagic stroke, for hemorrhagic stroke in many cases common is severe headache, nausea, vomiting, and may accompanied by change in alertness and consciousness. So change level of consciousness is important, and we should pay attention. It also, it can be sign of hemorrhagic stroke. First approach, first approach is CT scan to exclude hemorrhagic stroke, because in CT scan we can easily see hemorrhagic stroke as a bright part. You can see here it's hemorrhagic stroke, and ischemic stroke may be not seen in first hours on CT scan, so we can exclude hemorrhagic stroke first. And if it's ischemic stroke, timing is very important, and alteplase is gold standard of treatment, 3 to 4.5 hours after stroke and after symptoms occur is important, and aspirin after 24 hours or 48 hours. This alteplase is important for thrombolysis, and aspirin is important to prevent further stroke again. So both of these drug is important, and in case of hemorrhagic stroke, controlling bleeding, reducing pressure in the brain, and stabilizing vital signs are important, especially blood pressure stabilization. And what about transient ischemic attack? At this case, important is lifestyle changing, physical activity, cholesterol control, aspirin if needed, and if there is no contraindications. That stroke, what we should remember, it's important because it's second most common cause of death. Because it's very prevalent, it affects around 3% of population. We have two major type of stroke. It's ischemic and hemorrhagic, and we should remember face dropping, arm weakness, speech difficulties. It's sign of stroke, and weakness and numbness also, and difficulty vision, difficulty speaking, difficulty understanding also important. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.